I am Deborah Mariano, the Senior Public Health Nurse for the Toledo District, and this morning I am here to discuss a little about the introduction of the COVID vaccine here in the Toledo District. We know that COVID is around. We are in a pandemic. Worldwide, it is happening. So we would like to advise people firstly to take precautions. Wear your mask properly over your nose and your mouth. Practice social distance 6 feet apart. And proper hand washing, right, regularly. The COVID vaccine will be here in country end of March, early April. That's when the government is expecting the COVID vaccine, no? And the priority groups in the beginning would be first healthcare providers. And when I say healthcare providers, I mean doctor, nurses, data entry clerk, domestic, the groundsman, everyone that works on the compound of a health system, whether it be public or private, right? But first it will be public because we are the ones that come in contact with patients on a daily basis mostly, and then they will be looking to the private sectors, okay? After the healthcare providers have been vaccinated, then chronic patients will be vaccinated. These are patients that have diabetes, high blood pressure, are asthmatic, that has cancer, anything like that, they will be the second people to be vaccinated. Then we'll be looking at our elderly population, and after that, it will be the other population. Everybody else, no, will fall in that category. For the COVID vaccine, you will require 2 doses. The first dose, and after that, the second dose will be required to be given 28 days to 12 weeks. So within that group, that time, either 28 days after the first dose, you'll get the second dose, or within 12 weeks after the first dose have been administered, all right? And the 2 doses will have you become fully immunized. Right about now, they have not done studies to say if you'll need a booster, that must be given maybe on a weekly basis, not weekly, sorry, on a yearly basis, or every 2 years, or every 5 years, or every 10 years, or 10 years after. We are not sure. That study has not been done yet. But once you have gotten your 2 doses, then you are fully immunized. Okay, and also it will be given on the deltoid muscle, all right, on the shoulder, we'll say, or the arm. And the COVID vaccine group, immunization group, will be sitting down, the team, to plan campaigns when this vaccine has come in country. Because we know that some people are immobile. Not everybody can reach to us. So campaigns will be planned for us to go out to the communities, okay? Whether it's at somebody's house, if they can't move, we need to reach to them. So we'll be doing home visits. We'll be doing visits in the community, the different villages, all right? And for females now, if a female is in the reproductive age, that's from age 14 or 16 to 49 years old, we must do pregnancy tests. Why? Because studies have not been done to say if a female is pregnant, she can get the vaccine. So right now, that group is ruled out. We are not giving that group the vaccine because we don't know how it will counteract with the pregnancy. All right? So for females in the reproductive age, we must do a pregnancy test before we give them the vaccine because we don't want anything to happen that, we were not foreseeing. All right? And the vaccine could be given or should be given by any nurse or any doctor. It's not only the rural health nurses or the public health nurses in the districts. Any doctor, any nurse can administer the vaccine. Okay? And that is the little that I have to share right now about the COVID vaccine introduction in the Toledo district.